Carpal tunnel syndrome refers to this syndrome where the nerve in the wrist is caught in this area called the carpus. Where is the carpus? The carpus is this area in the wrist just above your wrist bone in this area. The nerve that is trapped is called the median nerve. So the signs and symptoms of carpal tunnel syndrome would be numbness or weakness or both. Why is that so? Because the nerve supplies two functions, sensation and strength. If the nerve, which is the median nerve, is compressed, you will get numbness across the distribution of the median nerve. Where is this numbness? It's usually around the thumb, index, middle, and half of the ring finger. So basically all across this area. Second thing is you may have weakness of the thumb muscle. Why is that so? Because the median nerve supplies this area called the thenar eminence, where the muscles of the thumb reside. So the numbness is caused by the compression of the nerve. As the nerve is compressed, it loses function and therefore it becomes numb. As it loses function, it also loses innervation to the muscle, and that's why the muscle becomes weak. Weakness usually is a late sign. Numbness usually is an earlier sign. Typically, what happens is patients get numbness when they are doing certain activities like reading newspaper, driving, or sleeping. Why is that so? Because as the wrist is either extended or flexed, the nerve gets compressed more and therefore it becomes more numb. In late stages, the patient can result in weakness in the wrist or the hand where they can drop objects. For example, they pick up a kettle with hot water, they can actually lose the grip and they can drop the whole kettle. Why does the carpal tunnel get compressed? There's a ligament across the carpal tunnel called the transverse carpal ligament. This ligament sits on the nerve which is going up. Due to all these activities or diseases, this ligament can get thickened, and as it thickens, it will press on the nerve, resulting in the associated symptoms. Both men and women are equally affected, but women usually a little bit more often. Most people get carpal tunnel syndrome around the age 35, 40 or later. Why is that so? Nobody really knows, but there are certain diseases that are associated with carpal tunnel syndrome. For example, obesity, diabetes, thyroid problems, or even pregnancy can result in increased carpal tunnel syndrome symptoms. The other group of patients that do get carpal tunnel syndrome are those who use their hands a lot. For example, they do manual labor that has a lot of vibration movement. This can also cause increased risk of carpal tunnel syndrome. Carpal tunnel syndrome is diagnosed based on a few things. First, the history means what the patient complains of. Then, the physical examination. There are certain tests we can do that may exacerbate the symptoms of carpal tunnel syndrome. For instance, we can ask the patient to hyperextend or hyperflex the wrist, causing more compression on the nerve, hence bringing out the symptoms of carpal tunnel syndrome. Second thing is we can actually compress on the nerve manually or tap it and reproduce the symptoms. Now, sometimes we do send the patients for a confirmatory test called the nerve conduction test. Using a nerve conduction test, we can check whether the nerve is compressed, because the results will tell us whether the nerve is transmitting signals at a reduced speed or a reduced amplitude. If that happens, we know the nerve is slowed and therefore being compressed, and this helps us to further confirm our diagnosis of carpal tunnel syndrome. Carpal tunnel syndrome can be treated in different ways. In the early stages, if the compression is very mild, patients can choose to take nerve supplements to supplement the nerve. They can wear a splint to ensure they avoid certain positions of the wrist that will aggravate the symptoms. For instance, you wear a splint to keep your wrist straight instead of bending this way or that way. This can help to alleviate the symptoms. Also, patients can learn to avoid certain activities that will exacerbate the symptoms. Later on, patients can take steroid injections, although this is sometimes controversial. Finally, the ultimate treatment is surgery. So in surgery, what happens is, usually it can be done under local anesthesia. A patient is awake, a tourniquet is placed on the affected site, the hand is cleaned and sterilized, an injection is given over the affected area where we're going to make a cut, and thereafter a vertical incision is made across the carpal tunnel region. The skin is cut, the subcutaneous tissue is spread out, the palmar fascia is incised, and finally the next layer is the transverse carpal ligament. The transverse carpal ligament is incised completely from the distal, which is the further end, to the proximal end, which is the nearer end, and underneath the median nerve is free. So thereafter the wound is closed and the patient can go home. So the whole surgery from start to end usually takes about half an hour to 45 minutes. There are certain risks to the surgery. Of course, if it's done under local anesthesia, it's usually very safe. The patient can do it as a day surgery procedure. Not in the clinic, but in the operation theatre. Okay. What are the risks for this operation? Every operation has risk of bleeding or infection. The risk of bleeding or infection is low for a proceeded carpal tunnel release because it's a small operation. The patient usually gets discharged with painkillers and antibiotics. Okay, what are the other associated risks of carpal tunnel syndrome surgery? Number one, of course, the main worry is the nerve. You can damage the nerve if you are not careful. This is usually uncommon. The more common mistake that some surgeons do make, but rarely, is making the incision too near the thenar eminence towards the thumb side, because there is a nerve that goes towards here. It's called the motor branch. The motor branch of the median nerve is the one that supplies the muscle of the thumb. If you go too near, you can actually cut that nerve and that thumb will be weak and immobilized. So that to me is the biggest risk for carpal tunnel release. Of course, there are other things like incomplete release resulting in the recurrence of the symptom. Very rarely do you end up damaging tendons or arteries or other neurovascular structures. These are very rare. Basically, it's quite a straightforward procedure. So the question is, what are the preventive measures of carpal tunnel syndrome? Basically, it is difficult to prevent altogether because if you are obese, if you have diabetes, if you have thyroid problems, you are at higher risk, okay? But daily activities wise, some patients do get increased risk of carpal tunnel syndrome if they have an activity or a job that has a lot of vibration. We know this for patients who use a lot of vibratory tools. They can have a higher risk of carpal tunnel syndrome. So therefore, you may want to avoid such activities. Gripping, playing tennis, playing sports is not known to have a higher risk of getting carpal tunnel syndrome.